like the slides not working and the audio not working in a room. It's all the same. It's just pretend we're in the real world. Hello, my name is Campbell and I'm chairing this session today. The session that you have joined is called Digital Resources for Carers. And as I say, my job is to chair it. We've got two presentations for you today. One from a London-based and one from a Northern-based. I'm not going into a bit more detail about that in a second. Next slide, please, Harriet. So the normal housekeeping. The session is going to be recorded and, as Steve and Dave said, hosted in NHS Futures. So please turn off your camera if you prefer not to be recorded today. We'd be really grateful if you could keep your microphone on mute rather than us having to mute you all. Because I don't like doing that. So if you could possibly please keep yourself on mute whilst the presenters are speaking. And what we'll do is I suggest that we have the Q&A at the end. So Ros and Lucy are going to go first. There'll then be a couple of minutes. Colin will start, but let's keep all of the questions to the end. What you can do, though, obviously, is please put any questions at any time into the chat box, and then my job will be to make sure that everybody's voice is heard. So let's do the Q&A at the end. You can enable closed captions or subtitles during the meetings using Teams settings. And as I say, recordings of the workshops will be available via NHS Futures. Next slide, please, Harriet. So this is my job today. This will be my focus. And as I say, I'm going to keep it fairly tight. So we've done my introductions. What we're going to do first is Ros and Lucy are going to talk about work that they are doing in a digital space in London with regards to care contingency. And then I'm going to hand over to Colin from Encompass to talk about the great work that they're doing in the north. So without any further ado, I'd like to hand straight over to Ros. Lucy?
Thank you, Campbell. I think I've got a couple of slides first, just outlining the context, the journey that got us here today. And then Lucy's going to do the exciting stuff, which is a demo and tell you more about the actual universal care plan and the carer contingency plan element within it. Could I have the next slide, please, Harriet? Lovely, thank you very much. So for those of you of a certain age, you'll remember the long-term plan from 2019, I'm sure. It's soon, very soon, if the HSJ is to be believed, be completely replaced as opposed to sort of, quietly forgotten about. But within the original long-term plan, or the long-term plan for 2019, was a series of commitments around carers, unpaid carers, which was really quite forward-thinking at the time, because I think it was probably one of the first times that they'd ever managed to get into an NHS really high-level, top-level strategy. So it was very exciting. There were a number. One in particular was around carer contingency plans. And the ambition in the long-term plan of the day was up to 100,000 carers will benefit from contingency planning conversations and have their plans included in a summary care record. So in London, we have the universal care plan, which is accessed through a shared care record. So the summary care record, I do remember the terminology. I kind of remember what it's about, but I won't be taking questions on that because my memory isn't that good. So it was a fantastic ambition. I think the difficulty that we realised fairly early on is that in terms of analogue, there was probably a lot more than 100,000 emergency cards or files in fridges or, notes on the back of an envelope. But actually, digitally, there wasn't really that much available at the time. And even if there was, we weren't quite sure where it was going or what was happening or where it was linked to. So, a really fantastic ambition. And really pleased to say that we have moved on. We've advanced, all areas have advanced, not just London, but certainly in London, we've definitely advanced on from that. Can I have the next slide, please, Harriet? Thank you. What helped us on our journey in terms of being able to actually quantify how many people had a carer contingency plan in some sort of digital form that was linked to either their GP or a healthcare professional was a fairly drastic review of SNOMED codes. I'm sure SNOMED stands for something. I don't know what. They're effectively the code that enables, the GP to know certain things, or other healthcare professionals to know certain things about you. I think initially when the national team, there was a national commitment to carers team, when they started this work, I think I'm right in saying there was around about 100 or so different codes that could include a carer. Because it was quite often something along the lines of cares for a person with diabetes, cares for a person with cancer. So it was very much done by disease group. So this really was a way of focusing that down. So we weren't looking and trying to find carers amongst 100 different codes. So they narrowed it down to 2. But also 2 new ones. One was around, has the carer got a carer contingency plan or an emergency plan? Same thing, but and also a way of identifying whether someone was no longer a carer, which didn't mean they didn't need support. It meant maybe it was different type of support that they needed at that stage. So all that kind of really helped to sow the seeds for what was to come. Harriet, can I have the next slide, please? Thank you very much. So some point around 2022, possibly early 2023, the Universal Care Plan team made opportunities available for different, what they called use cases. So basically this is different parts of the Universal Care Plan that could be added. And that might be around a disease group, or in our case, it was around a carer contingency plan, which covers all of those things. And indeed, a carer may not have any kind of illness, and hopefully it stays that way. So it was, for us, it was quite a broad, let's see if we can do this, which fitted in with that, that long-term plan ambition from so very long ago. So a previous colleague of mine, who many of you will know, Debbie Hustings, was leading the work at the time, and she brought together colleagues from local authority, community voluntary sector, unpaid carers, people within the region, people within the London ADAS. I think that's Directors of Adult Social Care, I forget what the first A stands for. So brought together a lot of people, to sort of develop an initial bid so that we could be included, which was successful, and then to work with that group to think, okay, we've got this big opportunity to have a digital carers contingency plan. What do we need in it? And that was really a lot harder than you might think, but of course they did it, and they did it absolutely brilliantly. So forward to January 2025, and delighted to say that the carer contingency plan is now part of the urgent care plan records. It can be seen, it can be viewed, they can be initiated, and we have had a soft launch. I'm going to tell you more about the end. I'm going to let Lucy come in a second, and then just tell you about the end, what's kind of happened since our launch last month. I thought it might be good for me, as well as for everyone else, to look at the original aims of the work and see how far we've got. So overarching aim was to design and implement a digital personalised care plan. We did that, so that's got a happy tick. There's also this really thorny issue of, whether it's on paper or whether it's digital, how do you keep this up to date? How do we make sure that the latest information is there, it's right, it can be seen by the right people at the right time? I'm glad to say most of that is out of my hands and in Lucy's hands. But we have, we've got together a group who will very much be around making sure that that is happening. There are obviously ways within the urgent care plan to track updates and various things like that. So there's sort of 2 parts to that. So I've given us a tick. I think it's probably a slightly smaller tick than the first one. we've got the system in place now. I think it's just the hard work of making sure that happens. The last one, we don't have a tick yet because that's stage 3, and I think probably the most important stage. It's rather grandly called Encourage Families to Think Strategically About Care Needs. Actually, it's about how can we encourage and support conversations with carers to think about what's going to happen if, and not just to think about it, but to actually support them to take action to make sure that once they've thought about it, we know what it is and how we can get that happening should the worst happen. I'm going to hand over to Lucy now. So that's just a really quick canter through how we've got to today. And Lucy is going to do the far more interesting bits, and then I'll come back at the end. Thank you.
Thank you, Ros. No pressure there. So I've got a few slides just to introduce to you what the Universal Care Plan is, so you can see a little bit about the background and the context of where we've grown from, and the work that we've been doing in tandem with Ros and colleagues. I've got an example in there which is based on a real-life example of how the UCP works in practice for carers. And then if there is time before we hand back to Ros, I have got a very short demo to give you of the UCP system. So what is the Universal Care Plan? So the key intention behind the Universal Care Plan, or UCP for short, is to communicate what matters to me and what's important to me alongside medical information. And I think we know that when it comes to managing health, we can sometimes be very focused on diagnosis and managing conditions, symptom management, testing, prevention. And of course, whilst that is all really important, it's also important to be looking at people in the context of their whole life. So looking at them as individuals, what does their day-to-day life look like? What are their well-being needs? What are they worried about? And perhaps they might be an unpaid carer. So the UCP brings a holistic view of a person to any professionals that are supporting them. So as you can see on the screen, it's a digital personalised care plan, and it was launched in July 2022. It was co-designed by lots and lots of stakeholders involved at that point in time. It's accessible to any and all health and social care professionals across London. So this means that NHS organisations can access it, as well as local authorities, hospices, care homes, and also voluntary sector. And because it's accessible to all of these professionals, it means that they can all be involved in providing personalised care. And that's really important when somebody might not be able to communicate any longer. The same information is available to all professionals involved. And for patients and also carers, this is really important because it means that they don't have to continually have the burden of repeating their story every time they see a new professional. The information is available across organisational boundaries, so it's not sitting within the silo of one organisation. The care plan itself is funded by the 5 London ICBs, and this means it's completely free for any organisation in London to use. And finally, just to add, it's a digital enabler for different clinical and other non-clinical pathways. So we don't mandate exactly how the tool is used. It can be used in a lot of different ways to support people with different wellbeing needs and different services. Next slide, please. If you just click through, I think maybe 2 times. Yeah, that's great. Thank you. So originally the UCP came from an end-of-life background. So it was primarily used to record things like CPR decisions, symptom management plans, as well as end-of-life care wishes. So it came from a very medical context. However, when we procured the UCP as a digital platform, we had the opportunity to expand the system to support other use cases, as Ros has mentioned. So in January last year, we launched the first phase of expansion supporting people with sickle cell disease, and the care plan now has lots of detailed information for those patients to manage a pain crisis. In January this year, we had the second and slightly larger phase of expansion to support all of the additional use cases that you can see on the screen there. So that included the carer contingency plan. However, it's really important to note that anyone who needs to have one can have a UCP. It doesn't have to be people that fit into these discrete categories. They might have any number of different needs. They might be a carer, and hence the name universal. Next slide, please. So the carer contingency plan is intentionally very simple in its design. So the first thing to note is that it flags to professionals, especially urgent care, that the person has got caring responsibilities. So we know that the UCP is well embedded already within urgent care services, and they are consistently viewing over 10,000 care plans every month. So this made the UCP a good candidate for hosting the carer contingency plan. Urgent care professionals can see all of the information about somebody before they've even reached the location that they require care at. Secondly, it provides brief details on who the carer is caring for and how long that person is able to wait safely on their own. And it provides details for a replacement carer. Finally, just to note that it doesn't include lots of detailed information about the cared for person. So, for example, it doesn't have things like medications, allergies, or specific management plans. That information can be recorded in the cared for person's own UCP, or it can be held in another digital system or by the carer or the replacement carer, for example. Next slide, please. So over the next few slides, I've got an example based on a real life example of how this works in practice. So next slide, please. Sorry, I'm going to be saying that a lot. So in this example, we've got Rachel and Tenny. So Rachel is 38 years old and she works as a project manager, and she's got sickle cell disease, and she's also an unpaid carer for her mum, Tenny, who has got dementia. So Tenny is 79, she's got Alzheimer's, she lives with her daughter, who, as we know, is an unpaid carer. So in this scenario, both Rachel, the unpaid carer, and Tenny, who is looked after, will have their own UCP. Next slide, please. So in the first part of this example, Rachel can log into the NHS app and access the UCP there. She can start this off by providing details about her mum in the carer contingency plan section and details for a replacement carer that might need to be contacted if an emergency happened. The UCP syncs with the personal demographic service, and this means that we can import personal demographic information directly into the plan. And as Ros has mentioned already, the UCP sends a SNOMED code that Rachel as a carer back to her GP system, so she's more easily identified. In the second part of this, the care plan is reviewed by her sickle cell haematology consultant through the London Care Record, and they can add information about Rachel's medical background, her diagnosis, management plans, and all of these things have been discussed with her. The UCP integrates, or will very soon integrate, with GP Connect, which will allow medication and allergy data to be pulled through and surfaced in the care plan. One evening, for example, Rachel experiences a very sudden onset of a sickle cell pain crisis, so her friend calls 999, and when that call comes in, the call handler can see a flag on their system that Rachel has got a care plan. The paramedics can also see the same information, and they can see an alert at the top that says that Rachel is an unpaid carer for her mum. So before they even go to check on Rachel, they can contact the replacement carer if that's appropriate. And the replacement carer is able to be there, which puts her at ease that her mum is not alone. She's left with someone familiar while she has to go to hospital. And the second part of this example, if you can go to the next slide, please. Thank you. So Tenny, Rachel's mum, she visits her memory clinic, and her CNS decides that it would be a really good time to start a UCP for her. So she does this through the local shared care record. She adds lots of medical details, and she also adds Rachel, her daughter, as a personal contact. She can indicate that she is also the next of kin, unpaid carer, and she has lasting power of attorney. The next step in this, the geriatric consultant, for example, goes into their patient record system, and they can see a flag that a UCP has been created. So they have a conversation together, a consultation, and they discuss things like Tenny's advanced decisions and any treatment escalation plans. And both Rachel and Tenny feel comfortable that her wishes to stay at home wherever possible will be upheld in an emergency. One evening, Tenny is experiencing symptoms of an infection, and Rachel calls 111 for some advice. And when the call handler answers, just with the previous example, they will receive an alert on their system that Tenny has got a care plan, and they can dispatch a GP who makes his way to Tenny's house. All of that same information that's documented is visible throughout the whole journey of from when the call is answered all the way through to the GP attending her house. And luckily they're able to prevent her from going to hospital, and they know that that's what she is, what she wants. Next slide, please. So how exactly can the UCP be accessed for patients and carers? If we can move on to the next one, I'll talk a bit about the NHS app integration. So we know that the NHS app is making a shift towards becoming a digital companion, and the UCP is really lucky in its opportunity to shape this. So at the moment, people can view their UCP on the NHS app, and this includes carers who can see their carer contingency plan. The next phase of this functionality is to give patients and carers the opportunity to create and edit their own care plans. So they can enter non-clinical information like contact details, what's important to me, like daily routines, hobbies, and also the carer contingency plan. The information sits front and centre alongside the information that's been completed by professionals like, symptom management or urgent care plans, creating a partnership between professionals and the public, and also giving people more autonomy over their own data. Finally, just to add that proxy access we know is on the NHS roadmap for third-party integrations, and hopefully we will have this opportunity with the UCP, which will enable carers to view the care plans of people that they look after. Next slide, please. This is what the NHS app looks like. You can see on the fourth screen that's got the universal care plan on it. The information is displayed in line with the accessibility and style guidelines from the app. And before we go into the next phase of edit functionality, we will be going through public testing. And this will also involve our People with Lived Experience group, which we have representatives of carers on there. And just to finally add access for professionals, if you just skip to the next couple of slides and then do a few more clicks, please. So we have all of these integrations which are listed on the screen, and this means that professionals will have a flag on their system to say that somebody has got a UCP. They can then click through and, for example, see that they're a carer. They can also edit the care plan through this access as well. For some professionals, they might not have these integrations. They can access the UCP through their through the web portal, which is a browser-based system. So that's the end of my slides. I don't know if there's any time for a really quick demo, or we can perhaps skip straight to Roz. I don't know how we're doing for time.
I'm very happy to give up my last slide because people can see
think
that.
Your last slide is important, Roz.
Oh,
Yeah, Lucy, I think.
Should we do the last slide and then I can send a video of a demo? Yeah. Okay.
Right.
Yeah, Roz, if you could do this and then.
Okay.
I think
I'm going to be really, really quick because I don't want to mess with Colin because that's not very nice. Yeah, so as I said, we had a soft launch on the 14th of May, just an online lunch and learn. And there has been a huge amount of interest with partners across London, which I'm really pleased about. I have to say, we weren't quite sure. So what we've got planned, we're coming at it from a few different angles, but what we've got planned, the two big pieces of work, I think, is working with community voluntary sector in a number of ways. One, to get them signed up so that they can initiate both the universal care plan and the carer contingency plan. They can support people to do that, which I think is really important. We did have a meeting with someone from the local medical committee in Southwest London because they were really concerned that carers would flock to their GP, demanding that they, not demanding, but asking nicely if they would set up a universal care plan for them. And I think we had to reassure them that that's kind of unlikely to happen because it's really difficult to get an appointment, and actually carers probably like a lot of people are thinking, I really don't want to bother my GP unless I absolutely have to. So we were able to reassure them, but actually the way in which I think we can really reassure them is by supporting others to be able to do it. So from social care and health, from voluntary community sector, they are, I think, our key partners. And I'm just so pleased that they're really embracing it. I was a little bit worried they might say, oh, resources could be a problem. Nobody has said that so far. I'm not saying they won't, but so far they haven't. We've had just one thing I will tell you, because this blows my mind. So Richmond and Wandsworth, for their accelerated care fund work, they're doing some AI work around contingency planning with carers. I don't really understand it, but it's about starting those conversations. They've just started that work, but we have promised to keep in touch, because that's a real possibility that actually AI could support a carer to get to the stage where it's developed enough that then that could become a carer contingency plan, if that makes sense. I find it mind-blowing, but I'm super excited about it. In terms of monitoring and evaluation, that's all done through the Universal Care Plan team. So we will know how many carer contingency plans have been developed, who is developing them, when they're being triggered. So we're confident in that, and we're really hoping to see some good data that we're more than happy to share in the future. Thank you. I'm going to stop.
Thank you, Rose. My mind is also blown for many different reasons. I think the first reason is that this is integrated care working in a digital platform, and it's been the dream for a long time. And congratulations to London for actually making it happen. I think one of the big issues that we've got, I think, from a questions perspective, will be, especially because I'm aware that this is only available in London boroughs at the moment. So I'd be really grateful if you put in the chat box, if there are any carers that live in London, how can they find out more about this so they can practically get on with it? And I'd be grateful if you could put that in the chat box. I think there's another session to follow with regard spread of this work. How can we make this work in other parts of the country? But what I'd like to do now is move on to Colin. Colin works in the, I said north earlier on, and apologies for that, Colin, because it's very much the northwest in Compass. And Colin's works specifically in the Lancashire Care Service, and he's going to talk today about the digital work that's happening there with regards, is it a carers community network, Colin?
Yeah. Thank you very much, Campbell. And thank you very much for the opportunity to come and share one of the innovative ways that we've been engaging with carers using what we call our carers community network. Next slide, please, Harriet. So just really quickly, a brief introduction. So I am a participation and engagement officer with the Lancashire Carer Service, which is delivered by Encompass. I've worked for the organisation for 12 years now, across a number of different services. And what I've really sort of built up is an awareness and an understanding of some of the challenges that people face and some of the challenges carers face, and how our service can specifically support them. So my role as a participation and engagement officer is to really have those conversations and to really come alongside carers who are going through that day-to-day caring role. But also what it is to work alongside health and social care staff in a lot of training around better identification and understanding carers and understanding the role that they play, and obviously how, you know, it's really important that we value and look after carers because of the impact that they can have. Supporting carers for me isn't just a job. It's something personal, because it's something that I see every day. And I hear their stories, and I hear their struggles, I hear their successes, and, you know, often coming to work, it's an absolute privilege and a passion of mine to be able to, again, come alongside carers every day. Next slide, please. So again, for those people who are on the call who don't know about Encompass, we operate across the north of England. We started out back in 1999 as a small charity up on the Fylde coast, very close to Blackpool, where we delivered some advocacy support. And now we cover the sort of northwest and sort of north of England, where we deliver advocacy, carers, well-being, and some volunteering opportunities. At its heart, what we place is the person at the centre of everything that we do. By delivering excellence, we build on people's strengths to stay well for as long as possible. Just a quick fact, back in 2023-24, on our system, we had nearly 54,000 carers registered with us. And we identified in that same year 8,600 carers. So again, that was a couple of years ago. So we're continually just building on that, sort of registering carers with us, identifying carers. So we have a good size number of carers that actually are registered with us. Next slide, please. So as you can see, we sort of are commissioned by the local authorities in these areas to actually support and deliver carer support. So our largest is Lancashire, because geographically it's the biggest county, but we have very sort of active carer support hubs in Warrington, Staffordshire, Bury, Knowsley, and Rochdale as well. So again, some of them are small metropolitan, but then some of them are the sort of larger county councils. Next slide, please. So let's take our minds back to pre-pandemic, which often for a lot of people is quite hard to imagine now. But actually, before the pandemic, what we decided to do was to do some sort of consultation work with carers, looking at potentially some gaps, looking at, you know, surveys, conversations with carers to see what they thought of the support. And I think one of the things that we sort of got out of that was face-to-face support was not accessible for everybody. And that could be for a number of reasons. Some carers work, and you know, much of that support is between that sort of Monday to Friday, 9 till 5, which is not really accessible for working carers. Some carers have caring responsibilities that are very time intensive and very sort of, you know, potentially even 24 hours a day, 7 days a week, where they struggle to leave their cared for person. Some carers are socially isolated. And what we know is that that's obviously a growing issue. And, you know, maybe again, struggle to interact with people because they've spent so long caring for somebody, which has naturally meant that you know, that those social connections are a lot more difficult. We also know that carers obviously live across a range of sort of demographics. Some are urban, but also some are very rural, and potentially transport links means that they're not able to access all of those sorts of face-to-face supports that you know, whether that be through again, lack of public transport, or you know, just where they actually live. So what we also recognised as well is that there was support that was missing in those out of hours. So that when services were closed, or weekends and evenings and through the night, there was often that gap in which, you know, where does a carer go? Who does a carer speak to in those times, you know, to get that help and support? So this has led us to develop our Carers Community Network to bridge these gaps. And in a nutshell, the Carers Community Network is a digital online platform that allows carers to come together virtually, talk, interact with each other, and engage about things that matter to them. So once we came up with the sort of the shell of that, we went through what we call our Citizens Involvement Board, which is very much like a service user sort of, where former people who have used our service were able to obviously comment and to evaluate our sort of ideas. We took this back out to carers and volunteers to really talk about what matters to them, what they thought of it. And then obviously we went via our sort of partners and stakeholders to say, look, this is what we want to do. This is how it sort of looks like. And then ultimately we'd come up with the Carers Community Network. Next slide, please. So let's talk about the key features of the network. So one of the things that we're really proud of is the Carers Community Network is 24 hours a day, 7 days a week, 365 days a year. So that means carers who are accessing it can access it any time of the day or night. And you know, whether that be Christmas Day, whether that be any bank holiday, it is there available to them. This actually benefits a number of carers or of carers in many different ways. Again, those who are working, those who we spoke about would struggle to access through accessing face-to-face support. So it just means that there is no point, there is not any point in which they would be able to not access the Carers Community Network. Also, thinking about accessibility, what we wanted to do is make it an app as well. So now what excuse me, what carers can do is once they're registered onto the network, they can actually download it onto their smartphone. So what that provides is that there's accessibility for carers on the go. And how I often speak to carers is it's like having 2,400 carers in your pocket going along with you. It is so all it needs is for a carer to pick up their smartphone and they can actually access the Carers Community Network. Also, what we found is that carers want the opportunity to discuss, share and exchange information. So we provide access to it via these sort of public forums. And how I best describe it from a service user perspective is the network looks like a Facebook for carers, in the sense that there is a central news feed in which carers can post to, in which other carers can comment on, and it's almost like a running, ticking sort of activity feed, like you would see on most social media platforms. What that does is it provides carers with that really, really important peer-to-peer support. And what it also does is it provides carers with that opportunity of that information exchange as well. Because ultimately there are many carers who want information that only other carers can really provide. And I think that that's really important in allowing a space for carers to share, you know, where to go, who to contact, what to say, and all of those sorts of questions in which many carers may have. But it's also important for us as well that we are able as a service to provide information to carers very quickly and very sort of relevant to their needs. So any information about groups, any information about change of services, we can very quickly put that information out across the Carers Community Network, which hits a lot of people very, very quickly. But also there is a private messenger function. So for those carers who maybe want to take, instead of those public conversations, want to go on and have those private conversations in between, you know, just two carers, very similar to a Facebook Messenger or a WhatsApp style sort of instant messenger service. That function is built into the network. So carers don't have to go scrolling through messages to find out where the conversations have been left. So it's really accessible for carers to build up those sort of relationships with each other to actually, you know, get that emotional support that's there. We do have hosts and moderators on the network between Monday to Friday, 9 to 5. Now, one of the questions a lot of people ask is, what about host and moderating over the weekend? And what we explicitly say is that we are not a crisis service. Okay, this is not a crisis level service. So these are the times in which it will be moderated, but there will be times in which, you know, there will be sections over the weekend where the network isn't moderated by members of our staff. We have quite an intensive terms of and conditions and the terms of use that obviously quite clearly stipulate what people can expect in terms of obviously and what we expect from carers accessing the network. One of the safety and security features that we sort of inbuilt into this is that this is an invite only network. So what that means is members of the public or anybody can't access it. So when somebody registers with our service, they are given a bespoke link or a private link for them to able to access the network. And what that does is it provides a safe space for carers to be vulnerable, open and honest, knowing that actually, you know, Joe blogs from the public can't access it. And actually, you know, so one of the things that carers have said is that they really value that we know who's on there, we know when they're on there, we've got emails, contact details of everybody that's obviously linked to the network. Next slide, please. I just thought I'd really sort of show some of the peer support that, you know, as it's one of the sort of major sort of areas that we really focus on. And this was just a conversation that happened not too long ago, where, you know, a member of the network was asking a question of somebody or asking a question around that sort of carer, where somebody, a care agency, you know, was coming in and not staying for as long as they thought they would do. And as you can see, obviously, people then were commenting on, you know, how they would handle it. And again, it's just a very, very sort of brief example of how the sort of peer support works in terms of obviously on the network. Next slide, please. But recognizing that we always need to change, and it's really important that we understand that actually, you know, we're not a static network, and we need to change. We need to change when the needs of carers change. One of the things that carers came back to us and said was that they really, really liked it, you know, at the beginning, but sometimes it was a little tricky in being able to find the information that they wanted. And, you know, so at the beginning, we created rooms in which information was shared and things. But then again, carers said to us, actually, we want a slightly simpler version. So then what we did was we changed to hashtags. So where we have a big public forum, but then hashtags will highlight different areas. And again, for us, what we wanted to do was make the user experience for carers as positive and as seamless as possible. We continually listen to carers, and you know, it's all about actually what they want and how we can obviously provide that to carers. Next slide, please. We provide, again, for us, it's a two-way conduit of information. So obviously carers tell us how their sort of user experience is, but again, we pass, like mentioned earlier, we pass a lot of information back to carers. So whether that be, you know, virtual coffee and chats, whether that be some sort of meditation and yoga, which is available digitally and for carers to access, whether that be sort of mental health training for carers and stuff. So again, it's not just a peer support, it's a way for us to be able to provide that help and support to carers. Next slide, please.
Colin, I'm going to be really rude.
Okay.
May I ask you to go to the next slide? Because
Yep,
I'm aware we've only got a couple of minutes.
Okay.
Yep. And I read that graph with regards adoption is just a really impressive graph.
Yeah,
and I would like you to talk to that and then let's sum
absolutely.
up if you don't mind.
Yeah, no, absolutely. So again, what we've seen is just continued growth in the network, and we're sort of around just under the sort of 2,500 members on there at the moment. And what that does is it just provides a really good size sort of group for people to engage with. We're probably seeing, you know, 1, 2, 3 carers a day really being added onto that network. So again, what it does is it just provides that sort of breadth of experience and knowledge for carers to be able to have that meaningful experience. Next slide, please. Again, just some very simple feedback. And if you just want to play the video, Harriet, there's a carer there who...
I really got to appreciate how important it was to have a good connection of other people, and it didn't matter whether it was the day or night. I could message somebody and know that somebody who was in a similar situation to me could get back to me at some point.
Colin, thank
Did
you.
you hear the video and the sound?
Yeah, sorry,
yeah.
did it not finish, Harriet? Was that, sorry, was that it?
That was it.
Oh, right. Okay. Sorry, I thought it was a little bit longer, but that's fine. Thank you very much. And I think I've just got my contact details on the next slide, if that's okay.
Colin, I think that was
I really got to appreciate how important it was.
That was, and again, was a fantastic way to end. Harriet, could you drop the slides, please, just for the final minute? We're not going to have time for questions, but what I'd like to do is just talk about ways in which the things that we missed today we can kind of get a hold of. Colin, first of all, that final video just with a carer demonstrating the impact of the network, that's bang on. I mean, that's really, really interesting. And thank you to you and the team for developing this. I love that idea of 2,000 carers in your pocket. But lots of questions with regard to how carers can get involved with the work, lots of questions about, and the big one is always about data sharing and kind of information. So again, please, I beg of you to contact Colin if you get any specific questions. The slides will be posted in the NHS Futures platform, and national team will tell you all about that, Steve and everyone. Lucy, Roz, the big one that we missed, I think, was that live demonstration. And that would have been brilliant to see. But again, given the nature of these things, we're not going to have time to do that today. A huge amount of questions for you both. Again, I can see why there would be a lot of questions with regards the flow of data, who puts the information in, how it all gets extracted. And I do feel that we are a very unfortunate generation. I feel that we're the testing generation for this. And I really hope that the work that Roz, Lucy are doing in London almost sets a test bed for how that work can flow so that we can get that adopted across the rest of England. That integrated digital work is the future. It's what Lord Darsley's recommended, and it's something that will happen. And it's going to be so much more easier for all of us now that you're both doing that. So with that, slides and recordings in the platform. You've got the contact details for the speakers. I'd like to thank everyone for talking today, and I'd like to thank Harriet for all her tech support moving the slides along. And if everybody could go back to the main room now, please. So many thanks, everyone. See you later.
Thank you. Bye-bye.